Hello and welcome to our health. My name is Binita Prajapati. I'm a family practice physician and I am practicing here at our health in West Orange, New Jersey. I wanted to thank you for coming on today and spending some time with me as we go over cholesterol. But before we begin, I'd like to briefly tell you a little bit about our health. Our Health is a network of primary care practices that are available as part of the New Jersey State Health Benefits. It is 100% free to join. There are no additional costs involved and no added copays. For more information on Our Health, or if you'd like to join, please visit our website at www.r-health.md/New Jersey. Or you can also call us at 1-800-797-1289. And don't forget, the number is still scrolling also on the bottom of our screen, so you can definitely refer to that. And of course, at the end of the presentation, I'll also repeat it for you guys, for those who missed it. Today, we're going to be discussing some cholesterol foods, so things that will help us lower our cholesterol, and also the importance of why we need to lower our cholesterol. Now, we're going to start with the basic, which is, what is cholesterol? Cholesterol is a waxy chemical substance that is found in our bodies. It is necessary for us to have it because it helps us in the production of cell walls and to produce certain hormones like testosterone and estrogen. Now, our liver makes up 80% of cholesterol. So the other 20% come from our diet. And our diet is from meat, poultry, dairy, eggs, fish. So, for example, after a meal, cholesterol is absorbed in our small intestine and metabolized and stored in our liver. So whenever we need to produce these cells or hormones, the liver releases the cholesterol for that to happen. Now, the problems start when there's too much cholesterol in the body. And what happens is when there's excess amount of cholesterol, we get what we call plaque buildup inside of our arterial walls. And that happens over time. These plaques begin to rupture, and then we can have blood clots, which can decrease blood supply. Why is that bad? Because a blood clot and decreased blood supply to a particular area can cause strokes or heart attacks. So, and depending on which part of the body that it's affecting, we will get in trouble. For example, if you're having leg pain, there could be decreased blood supply to the blood vessels in the legs, and that could be from a buildup of plaque there. And that's something that we as clinicians refer to as claudication. So now we know why it's bad to have it. The question is, what do we do about it? And how can we change our risk factors? Well, one thing we can't change is genetics. We know that genetics plays a significant role in cholesterol production. So what is the one thing we can do? Is we can work on our diet. And there are lots of things out there that talk to us about cholesterol lowering. There's medications, but before we get into wanting to have to take medications, the one thing we should do is focus on lifestyle changes and diet, because the American Heart Association does give us guidelines on helping us lower these cholesterol. And while the percentages and numbers seem super cumbersome, it's worth it, because at the end of the day, it's going to help us decrease our risk for heart attacks and strokes, among other things. So what does the American Heart Association say? Well, it says consume less than 25 to 30% of your total fat, of your total calories and fat. So basically limit your trans fat intakes by less than 1%, or limit your total cholesterol intake by less than 300 milligrams a day. Now, all these numbers, like I said, what does that translate into? translates into what we should be eating. And the remaining fats that we should be eating come from fats in like unsalted nuts, seeds, fish, like the oily fish. So I have a question that says, what is a trans fat? So the trans fat is created by, it's some sort of an industrial process that adds hydrogen to these liquid vegetable oils. So basically, it makes them more solid. So we see trans fats a lot more in like frozen pizzas, in like cookies, frozen pies, coffee creamers, shortening, things like that. So getting back to what I was saying, the most important things in our diet are decreasing so one of the things is decreasing trans fat, but also eating heart healthy. So the fish we talked about, the unsalted nuts and seeds. Avocados are a great source of what we call monounsaturated fats. And they might be a little bit high in calories, but they're the good fat and they help us bring our cholesterol levels down. Other things that are good are high fiber foods such as bran and oatmeal. And of course, fruits such as apples and pears. So, when we think about cholesterol lowering, it's not just genetics and it's also not just diet. We really do have to work on exercise, weight management, because everything works in conjunction with one another. It's not, one thing is not mutually exclusive of another. So, I think that if we were to all make healthier choices, I think we would all be better with our cholesterol levels. Hi, Shannon. It says that you're saying hello. Hope you're doing well. Do you have any questions for me, Shannon? So I really wanted to just implore everybody to get heart healthy and to choose to make healthier lifestyle choices. And I know that together we can partner to make a difference. So let's focus on those foods that are low in cholesterol and help us bring those cholesterol levels down. Artichokes are super good. Beans, very good. Garlic, very good. And, if you do have high cholesterol, definitely you can work on lifestyle modifications. You don't necessarily have to go on medications, which we call statins, which are one of the class of medications, among many others that are out there. But you can definitely manage with dietary changes and lifestyle changes like increasing exercise, because by increasing exercise and altering your diet, you will make a difference and you'll see those numbers go down. And we here at Our Health are ready to and willing to help partner with you to make that difference. Other things that we could talk about again are the importance of making sure that I have a question here. What are some examples of healthy oils? Well, healthy oils include olive oil, peanut oil, canola oil. Those are all some great, and safflower oil. And it really is important that it's not a time of day that's important. And although they do say biologically cholesterol synthesis, so highest amount of cholesterol is produced at bedtime. So that's when we end up taking most of our cholesterol medications. But I have to tell you that I think, it's eating healthy all the time. It's making sure that, you end up eating lots of vegetables and fruits and whole grains and beans and sunflower seeds. And if you continue to do it throughout the time, all the time, you will be okay. So my opinion in the red rice yeast supplement is there is an indication for supplements if um, for for dietary modifications if you cannot just do diet alone. I always recommend patients to start diet alone before starting any natural supplements because all of these things supplements are not as much FDA regulated. So, I'm hesitant to talk about how natural supplements could be the only benefit. I think dietary modifications come first and healthy lifestyle choices are most important. Supplements have their role, but of course, you should be monitoring liver testing and other things if you're taking any supplements. Um, Avocado oil is another good option for sure, and does help. Now, there are a lot of what we call saturated fats also. So saturated fats are they're a type of fat that have a high fatty acid molecules attached to it. So examples like fatty cuts of beef or pork or dark chicken meat or whole milk or butter or cheese. Coconut oil falls in that category. So does palm oil and lard. So I think that pretty much covers a lot of our cholesterol things. The other thing is adding plant sterol additives. So we see those plant sterol additives in like wheat germ and whole grains and beans. I'm sorry, I'm just going to go down and look at some messages. So how many people talk about a low-fat diet? Does that help? Absolutely. A low-fat diet is a diet that's low in saturated fats, which we just discussed. So really, we want to focus on more healthy fats. When I talk about healthy fats, I talk about fats that are like monosaturated. And monosaturated fats are fats that are liquid at room temperature. And of course, that helps with promoting low cholesterol because monounsaturated fats that stay liquid at room temperature don't solidify, as do trans fats or saturated fats that stay solid at room temperature. So you know that that's what's going on inside your arteries as well. Does anybody else have any other questions they'd like to talk about? Dr. P, how can I easily add in some of these healthy fats into my meals? Well, I would definitely encourage adding unsalted nuts or seeds into, say, salads, for example, or adding some avocado, because I think that avocado is, even though it's a little high in calories, it's high in monounsaturated fat, and so it's the good fat, so that's healthy for you. And of course, increasing fresh fruits and vegetables and making it a part of your daily routine is something that I think would be amazing and a really, really important and essential part of your lifestyle modification. But don't forget to exercise, and don't forget that a healthy weight is very important. So everything works in combination with each other. Can I answer any other questions for anybody else? Well, I really, really I just wanted to make sure we didn't have any questions. I really want to thank everybody for taking the time today to, chat briefly about cholesterol. I really welcome each and every one of you to give us a call, come on in, see the practice, see any of our health practices. We would love to partner with you and develop healthier lifestyle changes for all of us. So once again, our health website is www.r-health.md/New Jersey. And our phone number is 1-800-797-1289. We have one more question here that says, what kind of exercise should I be focused on? Well, I think any exercise, so the American Heart Association recommends 150 to 200 minutes of aerobic exercise a week. So that's looking at 30 to 40 minutes 5 times a week. So that's getting our heart rate up. And that's important because as we get our heart rate up, our cardiac output gets better, we lose weight, we feel better, we have certain hormones that are secreted from within us that help us with weight and blood pressure management. The next question is, what is the recommended range of numbers for different cholesterols? So really, I mean, the gold standard really is less than 200 for total cholesterol. But it's really more of an individual basis based on what other risk factors you have, such as hypertension or high blood pressure, diabetes, because when we have diabetes that's equal to a heart rate, heart disease equivalent, so what ends up happening is we want to lower those numbers even further than what somebody who doesn't have diabetes has. So depending on what chronic conditions you have, we would love to partner with you to make sure that we get your numbers as low as possible. Is there any other questions that we can talk about today? If not, I thank you very much for your time. And like I said, we welcome you all to our practices and look forward to hearing from you soon. Take care and have a great rest of the day. Bye-bye.